Hi, I'm Shauna, a licensed professional counselor with Lucid, here to talk about social drivers of mental and physical health. So, what makes us healthy? When it comes to mental and physical health, it's not just our genetics. Most of our health is shaped by the world around us. That includes having a safe place to live, enough food to eat, steady transportation, and people to count on. There's a term for all the non-medical things that shape our health. It's called social determinants, or drivers of health, or SDoH for short. SDoH are everywhere we live, learn, work, play, worship, and age. They have a big impact on how we feel emotionally and physically. Here are some things to know about social drivers of health that can help you stay healthy or to recover faster. Social drivers of health can increase your risk of getting sick, and if you do get sick, they can make it harder to get care. For example, someone might have a genetic risk for cancer or depression, but if they have a steady income to buy healthy food and get regular exercise, the risks may go down. Now, let's say they're working multiple jobs just to get by. This can make it a lot harder to cook healthy meals. And if they're diagnosed with an illness, it will also be hard to find time for their medical care. This is why it's important to get regular screenings to know if and how specific things are standing in the way of your health. The last time you saw your doctor, they might have asked you questions that felt pretty personal. Questions about your living situation, relationships, financial stress, or transportation. You might have also seen these questions in a survey before the visit. These questions are now a standard part of care, and for good reason. The more your doctors understand your day-to-day life, the more they can do to provide the best care. Here's a common example. A patient keeps missing their doctor's appointments because they don't have transportation. The doctors don't know this, so they charge no-show fees and ultimately drop the patient. Now that person has medical debt and they have to find another doctor. But if the doctor had known about the transportation issue, they could have offered telehealth or helped the patient find a ride. So, if there's something going on in your life, speak up. When you share, you are giving the provider information they need in order to best help you. Diseases don't discriminate, but minority populations typically have higher social determinants of health. Discrimination, language barriers, and income inequality can all make someone less likely to get care. Stigmas in some cultures around mental health treatment can also lead to social isolation and loneliness. Loneliness and lack of emotional support are the two most common SDoH risks, and both are more common among Black, Indigenous, and Hispanic adults. A lot of these social health factors can feel out of your control, but you don't have to face them alone. There are lots of local groups and people available to help. The hard part is usually knowing how to find them. Community health workers are trained to spot challenges, advocate for you, and connect you to resources. Health insurers also have care managers who can perform a similar role. Remember, if you're going through something that's affecting your mental or physical health, it's okay to talk about it. If you don't think friends or family will understand, reach out to a professional through your insurance or employee assistance program. If you like this video or want to know more about mental health or self-care, follow our YouTube or social media accounts or check out our resource library at lucithealth.com/resources. Thanks and take care.